DocTalk, brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there and welcome to DocTalk. Dr. Dan Thompson here with Dr. Greg Hanslacek, who is the Production Animal Field Investigation Director here for the Veterinary Diagnostic Laboratory. Great to have you on the show.
Glad to be here, Dan.
You got to have a fun job doing kind of what I'd term the CSI investigations, where you're going out and we have a case and you're working with veterinarians and producers and pathologists and trying to come up with an answer as to why we might be having an issue on a farm.
That's exactly what it is, and it's a blast. It's a blast working with Kansas producers and veterinarians, and then interacting our pathologists and our specialists to be a part of the problem-solving team.
You bet. And today we're going to talk about something that's pretty big, bovine leukosis virus. And seeing dairies and beef operations, what are we talking about with this virus?
Well, it is a virus, and you're right, it's called bovine leukosis virus, but some people call it BLV, some people call it leukosis. The technical term is enzootic bovine leukosis. So there's about 50 different names for the same disease, but it's a virus that attacks a certain white blood cell type in cattle.
So this thing is viruses, from my recollection as a practitioner, and how does it spread? I think that's a big question that people have out there.
It is, and it's an important question. Because it attacks white blood cells, anything that moves blood from a positive animal to a negative animal, that's the way the disease is going to be spread. So
give me some examples. I'm assuming bugs and different things can...
horse flies and heel flies, that's one of the ways, but the major way is needles. The needles when we vaccinate an animal from a positive to a negative. That's a big way it's spread.
So if we inject a positive animal and the virus gets on that needle, and then we don't clean that needle or don't change that needle and use it on a negative animal, we're going to...
That's exactly right. Or tattoo pliers that aren't disinfected between calves if they're tattooing calves. Gouging dehorners. If we're dehorning our calves and we're not disinfecting those between calves, we have a potential rectal palpation sleeves.
So what about nose to nose, or just cow to cow?
No, it takes blood to blood. It is passed through colostrum, so there is a colostrum issue there.
Which anything in the milk is going to be pretty much considered the same as in the blood.
That's right. Although there is controversy on that, there's belief that if it's in the colostrum, it actually provides protection for the calf later on if it becomes exposed.
Because the cow has been exposed and probably has antibody against BLV.
That's right. So colostrum, maybe not, but certainly any type of blood transfer.
Cool. Well, when we start to move forward with this discussion, I think when we come back, it'd be really interesting to talk about the clinical signs, what producers should be looking for in their animals, different things that we see in the production side.
You bet.
We sure appreciate you watching Doc Talk. We're going to be right back after the break with more with Dr. Greg Hanslacek talking about BLV.
DocTalk, brought to you by Kansas Pork Association, assisting producers and informing consumers.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine, where I'm joined by Dr. Greg Hanslacek, who is the Director of Production Animal Field Investigation here at the Veterinary Diagnostic Laboratory. And we're talking about BLV. We have talked about that it's a blood-to-blood transmission. So how big an issue is it? What kind of prevalence rates are we seeing in herds, whether it's dairy or beef?
That's a great question. The latest estimate was about 90% of all dairy herds have at least one positive cow.
Wow.
And about 44% of all dairy cows are positive. Now on the beef side, the estimate is about 10% of all adult beef cows are positive for this virus.
Wow, so that's the individual rate, and probably, although we know there's probably pockets and herds that are higher than that, when you spread that across, you're talking about more than 10% of the herds.
That's right.
Probably being positive.
That's right, especially on the beef side. Smaller herds have a tendency to have more positive animals because they more intensely manage their cows, purebred herds and those kind of things. So you're right, it's in pockets.
Right. So it's a growing issue, and it's something that's present on nearly all dairies and in a big population within the beef herd. So what, as a producer, if I want to know, or I'm sitting out there going, I wonder if I got it in my herd, what are some of the things that producers should be looking for or clued in on?
Okay, great question. The first thing is that the majority of positive animals will never show clinical signs.
Of course.
Yeah, I mean, that's just the way it is, right?
Right.
But as animals get older, that's when we're going to start seeing the clinical signs. So in a cow, we're talking animals as they get 4 to 5 years of age, they will start developing tumors, basically, is what they're going to see.
So let's talk about the progression, and if it's tumors. So is this this leukosis virus? Is it somewhat that when you're producing tumors? Is it like what's producing these tumors?
It's the virus effect on the white blood cells. So any place, the lymph nodes particularly, where the white blood cells are congregated, those start to expand in size.
Okay. So really what we're looking at is the expansion or the destruction of the white blood cells at places that they congregate, and these tumors are really just proliferation or damage to the white blood cells in these
That's right.
pockets. So it's not cancer. Or
well, they're tumors, so it is a cancer, and one of the
Okay.
terms that people use is lymphosarcoma, which means cancer of the white blood cell.
Gotcha. Gotcha.
Yep.
So it's a virus-induced sarcoma.
That's right. It's a
that
virus-induced cancer is what it is.
So we're going to see things, we see things such as the eye bulging in these cows due to this lymphosarcoma, different things like that.
Yes, that is a classical sign, is a cow that has, what I've seen in practice is one eye that bulges out. A lot of times there's a tumor behind that eye, and that's just classical for BLV.
I gotcha.
And other clinical signs are they'll just have lumps, and particularly in front of the shoulder, in front of the back leg. And then if a veterinarian goes in rectally, a lot of times the abdomen is just full of tumors.
Great information. When we come back from the break, we're going to learn more about BLV from Dr. Greg Hanslechek.
DocTalk, brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, and welcome back to DocTalk. It's Dr. Dan Thompson here with Dr. Greg Hanslechek, who is with the Kansas State Veterinary Diagnostic Laboratory and does a lot of production animal field investigations. We're talking about BLV. And so, is there a production loss associated with BLV?
There is. For those cows that haven't got to that stage where they start showing the tumors, we know it affects production, affects reproduction, those kind of things.
So we might be seeing some open cows,
yep.
Some things like that. So it's another thing that might be on our list of differentials when these cows aren't rebreeding.
That's exactly right.
Okay. Now, speaking of diagnostics, and speaking of biosecurity, what are some of the things that you would recommend to a producer once they find out, well, I've got some BLV in my herd? What are some of the things or things that we might do to prevent spread?
Well, the biggest things are change needles between animals.
Mm-hmm.
Make sure the veterinarian is changing sleeves between animals when they palpate.
When they rectally palpate.
And there will be a lot of pushback on that. But anything that a producer can do to reduce the spread of blood from one animal to another. So we're talking new needles, new sleeves, disinfectant dehorners, tattoo pliers, those kind of things will.
Fly control.
Fly control, I mean, that's harder to do, but that's certainly on the list of things they need to do.
So what about an introduction of new animals to a herd? Is there something there? I mean, should we test for BLV on the way in, or if we're trying to keep a BLV clean herd?
Right. Well, there are a couple tests out there, blood tests that'll diagnose BLV in incoming cows, and it's probably more important on purebred herds because it will affect their exports and whether they can sell bulls to bull studs, whether they're BLV positive or not. But certainly a blood test, either an ELISA or what we call a PCR, will identify those positive animals and then go from there.
Always work with your local veterinarian to diagnose?
Absolutely, yep.
Yeah, and so we've moved from, it's in the older cows, we're gonna see the clinical signs. We may see decrease in some of the reproduction or conception rates. We're gonna change our needles, anything that sleeves, anything that's blood to blood.
Yep.
What about the bulls? Can they pass BLV in the semen to the cows?
It's been known to happen, and that's one of the reasons why bull studs want negative BLV animals, coming in the bull stud. But it's minor compared to blood from animal to animal.
Okay. But if you're bringing a new bull in, purebred bulls, are a lot of these being tested up front or not?
Some are. For those producers, those purebred producers that are concerned with how much BLV is in their herd, they're certainly testing. And so that's a great question to ask when you buy a bull. What is your BLV status?
Good idea. It's got to be good for control, and especially if you're trying to keep your herd clean.
Well, it's always better to prevent it and not bring it in than it is to try to clean it up after it's in the herd.
Great advice. Thank you so much for watching Doc Talk. After the break, we'll do a wrap-up on BLV with Dr. Greg Hanslechek.
Doc Talk, brought to you by Kansas Pork Association, assisting producers and informing consumers.
Hi there and welcome back to Doc Talk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, joined by my friend and colleague, Dr. Greg Hanslechek, who is the Director of Production Animal Field Investigation at the Veterinary Diagnostic Lab. We've been having a great discussion on bovine leukosis virus. And, one of the things when we were talking about, not only on the show but during the break, is, BLV and causing these tumors, is this something that producers should be concerned about when they're sending these animals off to slaughter?
That is a great question, because yes, the latest statistics that I've seen, 2 out of every 100 cull cows are condemned after slaughter. So they're killed and then they're...
Because of BLV?
Well, the number one reason why they are condemned is BLV. So they've got the tumors that that the meat inspectors find.
So when these cows are sent to slaughter, then they're inspected by USDA veterinarians. 2% are condemned, and the largest number of them that are condemned are due to BLV.
That's exactly right.
Gotcha. So that, when we were also talking earlier, some of these cows don't ever show clinical signs. And so they could be BLV positive and going to slaughter. Is there a concern, a food safety concern, of bovine leukosis virus being present in an animal for me when I get that hamburger and put it on the plate for my kids?
Another great question. There's been a lot of research that looked at the potential for people either consuming meat or consuming milk that was contaminated with this virus. Is there a higher incidence of leukemia or cancer? And every research project that I'm aware of has shown that there is no association between exposure to BLV and human cancers.
Right, just like a lot of different viruses that humans get that only affect humans, or viruses that only affect pigs, or bacteria or viruses that only affect cows. This is not then a zoonotic disease, meaning it's not something that cows transfer to humans.
That's exactly right.
And cause disease in humans.
That's exactly right.
So I think that's really important when we're talking about some of these clinical signs and the condemnation rates, to make sure that we assure the public and the consumer that BLV is not something that's zoonotic.
That's right.
You said they've even looked at it in dairy workers and people in slaughter plants and things like that.
They have. They've looked at dairy herds where they were positive for BLV versus herds that weren't, and they followed them for 20 years.
The people.
The people, and
yep.
They found no higher incidence of cancer in those people that drank the milk and were around those cows on a daily basis compared to their general population.
It's just some absolutely phenomenal research and great information.
Yep.
You've sure provided us a great show today, and we're always thankful when we get to steal you away from your busy schedule to come on.
I appreciate it.
Thanks, Greg. And thank you for watching Doc Talk. Remember, if you want to learn more about what Dr. Hanzlachek and I do here at the College of Veterinary Medicine, you can go to the web and find us at www.vet.ksu.edu. Remember, we always recommend that you work with your local practitioner. Again, I'm Dr. Dan Thompson, here from the College of Veterinary Medicine. You've been watching Doc Talk. We're sure glad you joined us, and I'll see you down the road.